So nurses are feeling the ongoing effects of the pandemic, which still is having a major impact to this day, and they're looking elsewhere to escape the stress. And who can blame them? But their escape is going to be America's pain. Check out this headline right here. 1/3 of US nurses plan to quit profession. And this is coming from a report. The survey of over 18,000 nurses conducted by AMN Health Services Inc. in January showed on Monday that 30% of the participants are looking to quit their careers, up 7 percentage points over 2021 when the pandemic triggered wave of resignations began. The survey also showed that 36% of the nurses plan to continue working in the sector, but may change workplaces. All right, so the nurses are fed up and they burnt out. And many of the nurses cited fatigue, and we all can understand that, from the COVID-19 pandemic, which understandably has left them overwhelmed. AMN Healthcare CEO Gary Grace said the following: "This really underscores the continued mental health and well-being challenges the nursing workforce experiences post-pandemic. And the exodus affects every medical profession. We already in this country, just in case you didn't know, newsflash, we already have a nursing shortage. The national nursing shortage dates back decades. But the COVID-19 pandemic pushed it to crisis levels. One study predicts that in the next 2 years, there will be a shortage of up to 450,000 bedside nurses in the United States of America. And it's not just mental stress, it's literally death too. This headline from when the US hit 1 million COVID deaths in May of last year really states it all. This right here, the US reaches 1 million COVID-19 deaths. Thousands are healthcare workers. So Jackson, let's have a conversation about this. You know, when nurses get fed up and they're ready to go, most who go into the nursing profession see it as a ministry. I say many, I know there could be some outliers, but many of them see this as a ministry. And when nurses are sounding the alarm about their mental health, their physical health, certainly not being paid enough, not being appreciated enough, we gotta step up and pay attention, because this is gonna have a ripple effect for each and every one of us. This shortage is going to hit us, and 450,000 is the prediction. America, we got a problem.
Yeah, and I mean, that's a really staggering portion of the job market in that sector. And the reality is that nurses really do the grunt work and the dirty work of the hospital. They're the ones really who keep it running. For the most part, the attending doctors, they're specialists and they come in to do the highly skilled work in terms of knowing how to slice people open and knowing exactly how much anesthesia to put into people. Other than that, nurses basically are the ones running the hospitals and making sure everybody's okay. So a huge shortage obviously is a huge problem, rather equivalent to a teacher shortage. But it all boils back to the same types of things, because as you pointed out, many view this profession as a ministry. The same goes for education. It's not necessarily something that you plan or expect to make a fortune from. It's not necessarily something that you get into other than for helping people. There may be other reasons, but primarily that's it. So it's just that they're not taken care of well enough.
No, they're not.
That's all it is. It's that simple.
And they ought to be able to make a good living. I mean, you should be able to make a good living. And the healthcare system, America's form of healthcare, because I often call it sick care, but America's form of healthcare can't survive without the nurses. It just cannot. It just cannot. Like, this is not even up for debate, Jackson. It cannot function. It can't work.
Yeah. Again, I mean, it's like a restaurant with no servers.
That's right.
Or a restaurant with something that's drastically missing. So the business itself just won't be able to run. But again, these really point to the simple solutions. Most of the problems that America has really aren't complicated to understand, and the solutions really aren't that complicated either. We just need to move in that direction and keep on trying some more.